Hi, my name is Greg Fell, I'm Director of Public Health. In this video I'll talk a little bit about the next few months and how that might pan out. Firstly, numbers, so the infection rate has come down massively compared to where it was a couple of months ago. It's as I've said, it's proving stubborn. We know we've shifted to a space where we've got evidence of transmission, mainly households in certain parts of town, and we're focusing very much on that. Everyone wants to know the magic numbers. A couple of weeks ago, the numbers in Sheffield came down to about 7-day rolling incidence of 11, 12 per 100,000. They've crept back up since then, and they've crept back up for a reason, because we've massively increased the testing that we've done. So we've doubled the amount of testing that we're doing. And if you look, you're going to find. So the numbers are creeping back up, and that is a worry. It's not unexpected, and we're keeping a very, very, very close eye on that one. So then what might the next few months look like? The Prime Minister's speech on Friday of last week made very clear that the government are willing to ramp up local interventions and make changes to national plans with very, very short notice. So for Bradford, Calderdale and Kirklees in Yorkshire, that has meant return to stricter rules about mixing indoors. That was in direct response to an analysis that was done by Public Health England in the North West and in Yorkshire that said most contacts of cases were in the household setting. We've also seen that the Office of National Statistics weekly epidemiology very clearly tells us that the numbers are beginning to creep back up nationally. It could be characterised as just a slight uptick in the number of cases, and we're all keeping a very, very close eye on that one. It was clear that the Chief Medical Officer and the Secretary of State for Health were very concerned about the situation in Spain, and that was a scenario similar to what we saw in the early stages of the pandemic. So it's very, very clear that we're not out of the woods by a long stretch yet, and the slight uptick in numbers in Sheffield was expected, given that we're testing a lot more, but as I say, we're keeping a very, very, very close eye on it. So we know what's happening isn't really about failure to comply with the guidance. The guidance is not that easy to understand all of it, to be honest. The basics are fairly common, but what's happening is the rules were changed, people were beginning to mix more, and as a result cases are beginning to go up again. What we will and are doing in response to that is basically we're calling it an enhanced strategy. So we have a strategy for the City of Sheffield. It's broadly about keeping people safe from the virus, protecting the vulnerable, reopening Sheffield in all of its aspects as soon as it's safe to do so, and following government guidance. So that's broadly the strategy. That's the strategy that we've been adopting for the past couple of months now. A few weeks ago, we adopted what we're calling an enhanced strategy, which was really pushing testing and contact tracing around the local epidemiology, and the local epidemiology is pretty clear. Most of the transmission now is around household clusters. Not all of the transmission, but most of the transmission is around household clusters, and very, very localised transmission in communities. So that's where we're pushing our testing, but testing only really works if we also don't forget the basics. The hand washing, the distance continues to matter, that staying at home if you've been recommended to stay at home if you're isolating. Those are the things that really, really, really reduce transmission. So the things that make most difference are minimising the time from onset of symptoms to getting a test. That has the biggest impact by miles. That's why we're asking people, even with mild symptoms, to go and get a test, and get a test quickly, and making that available and accessible, making testing available and accessible. Optimising testing and tracing coverage. So NHS Test and Trace is here. It's broadly working, but we know we need to improve it within certain parts of Sheffield. And minimising the delay. So speed of finding people really matters, and we're working very closely with NHS Test and Trace and others to optimise the speed with which we get to people. So there's probably some more that we need to do around COVID secure environments. COVID will be with us for the next couple of years is my guess. So we're going to have to change the way that the city operates, and that will probably be a semi-permanent change. So the stuff around face coverings, the stuff around distance will continue to be a feature of our lives for some considerable time to come. I don't think anyone wants to get into the space of harder edged enforcement on social distancing in pubs and restaurants and those kinds of things, but those things may come. There's a lot more that we can and are doing around comms and messaging, so we're pushing quite hard around young people. Young people think they're going to live forever, think they're immune from the virus, and most of them will have really, really mild symptoms, but they may pass it on to their elderly relatives and other vulnerable people, which is much more of a concern. So we're still encouraging people not to hug and handshake, particularly with people from outside your household bubble. Elbow bumps work perfectly well, and as I say, we're pushing the getting tested early really, really hard at the moment, particularly in some parts of town. So contact tracing is here, it's working, it's going to be working for some considerable time to come. It's a key part of the recovery of the city, there's no two ways about that, and recovery is contingent upon getting contact tracing right. It broadly works, it needs to improve, and we need to improve its reach and speed of coverage, particularly with some of the communities that we find harder to reach. So some of our ethnic minority communities, some of the communities in various parts of the city that historically we haven't found very hard to reach. Contact tracing's got to work there, it's got to work there really, really quickly. So we'll be working with lots of people, both council and stakeholders involved in the community sector, to improve the reach of the contact tracing measures. We will soon probably be getting into targeted street by street, community by community work, and working with the voluntary and community sector to spread the key messages around what you can and can't do, what you should and shouldn't do. The insight work that we get consistently tells us that people don't understand the rules. The rules are quite complex, to be honest. I'm not sure I understand those rules sometimes. So we will be doing some door-to-door work in the not too distant future in some parts of the community